Let's talk about Dr. Tiller. What were some of the reasons or the comments made by Dr. Tiller that justified these late-term abortions?
Well, he had mostly social reasons for thinking that the late-term abortions were suitable, that the children wouldn't, that the offspring would not thrive, that the woman would have her future redirected, that they wouldn't get a good education after they had a child, that they would be always guilty in some way about having this child, that they had been abused already, and that this to have the baby would not be another form of abuse. Again, these ideas that he was expressing, these again are not psychiatric ideas, these are social ideas that he is proposing. And by the way, again, there was nothing to back these things up in a substantial way. And by the way, as well, there was no plans being made for these young women, whether they were going to be aborted or not, to be seen and followed up and given counsel and support and kindness and doctoring to help them readjust.
So just so I understand your last point, there was no effort made for continuing psychiatric care after the abortion was provided?
There was no psychiatric plan for care to follow on after the abortion. And of course, there was no plan being proposed alternative to the abortion in relationship to these statements about what might be the social consequences of having the child. So, as I say, these elements, these little bits and pieces, you couldn't employ to get a true picture of the person. And the pieces that were picked out, some of them, as I said, were quite trivial, in my opinion, although for the doctor and maybe for the young woman, they might be considered more serious. But certainly, being able to go to a sporting event, being able to go to the prom, go to a concert, there's a life at stake here, and much more serious issues need to be brought up, particularly if you want to obey the Kansas law that says some serious impairment is required.
And when you talk about those specifics, those lifestyle changes that some of these women would have seen, not being able to play a sport, you also mentioned not being able to attend a music concert. Are you just pulling those out of thin air, or are you recalling those?
No, I'm recalling them. Those are specifics. I don't want to go any further into the details of it, but let me just say to them, those were the kinds of things that are in there with some of them, okay? And I was surprised that first of all, I thought most of them, the person could go to those things, whether they had, lots of people go having had a baby and go to concerts and go to sports and go to and get educated and all of that. And occasionally you would hear someone say, well, their suicidal ideation will increase. I mean, and those things were said by Dr. Tiller.
Dr. Tiller said that if the woman remained pregnant, her
suicidal ideation might increase.
Is that true?
Well, the interesting thing to psychiatrists are that being pregnant and then being a mother of a child up to about age 1 actually reduces the suicide risk of women by 3 to 8-fold. Not many people know that, even though it's substantiated in the medical literature. It's nature's, we'd probably have to accept the idea that nature does protect us. Pregnancy is a burden for everyone, and yet something out of nature alters the attitude of these women, even when they're distressed about the meaning of their life and the meaning that this life they carry has for them. So an argument can be made, because certainly abortions and miscarriages lead to the restoration or the increase in the suicidal risk. The suicidal risk of these women is restored to the same risk of women of the same class, age, and background. It's always difficult to make a claim that suicidal ideation will be increased when you know that abortion and miscarriage, in fact, increases the suicidal risk. Now, once again, the key to what I've been saying here in Kansas is not simply that these single statements are not weighty, but that these single statements are not embedded in a psychiatric understanding of these patients and these people that would in any way approximate a stance on which the defense of an abortion could be made. These cases have not been studied thoroughly. And the diagnoses that have been made, such as depression, adjustment disorder, and the like, those are not substantial and permanently impairing conditions. Those are conditions we psychiatrists deal with all the time.
And are you confident to say that not just yourself as a psychiatrist, but others in your profession would agree that those types of single episode depression, adjustment disorder, anxiety disorder, that those are not substantial or irreversible?
Oh, I'm quite confident that 100% of psychiatrists would say that those are not irreversible conditions, since most of their practice is taking care of exactly those things and restoring people to their mental health. We do that all the time. And again, that's why I'm saying that the surprising thing was that if it was believed that these were the proper diagnoses, by the way, I think these young women were all in a demoralized state of mind. These diagnoses become almost interchangeable, at least on the evidence that's produced here. They're all fundamentally demoralized young women, and what they needed was support, help, care, and long-term treatment for the situations that they had, were in which they felt abandoned, so that they could once again feel, as they should feel, that their future is rich.
I'm quite shocked at something you mentioned, that there was no process put in place for them after the abortion for follow-up psychiatric, psychological care. Isn't that a breach of medical care?
Now, as I say, I'm only talking about what the records showed. I saw no evidence in the records for this kind of thought. And it relates to my concern about these records as not being adequate either in what they brought to the case or what they proposed for the case other than the abortion. And I had to ask myself, looking at these records, is any person who comes to this clinic ever found not to be appropriate on psychological or psychiatric grounds for abortion?
Well, and let me ask you that. Did you ever see Dr. Tiller reject a request for a late-term abortion?
No, I saw no records of a rejection of this by anybody. And I'm not saying that that don't exist. I'm saying that looking at these records and what they were employed to do, I can't imagine that anyone wouldn't satisfy those criteria, even those criteria didn't meet my views for a substantial and irreversible condition. That's what I'm saying. I don't know whether Dr. Tiller had rejected on psychological grounds other people. I can only tell you that from these records, anybody could have gotten an abortion if they wanted one.
Could the average person have looked at these records and agreed with you? Would it have been difficult for someone off the street to understand that it didn't meet the requirements of the law?
Well, no, I'm not sure about that, because the understanding of what single episode depression, adjustment disorder, those are not everyday corner store words. They are professional words, and they carry for psychiatrists a different meaning than they would carry for the ordinary person. But I think they can be explained to the ordinary person, and they could understand in what ways these are similar to experiences that everyone has. As I say, when I look at the records, as far as I can tell, all these young women were very similar in the sense that they were all demoralized. And what other diagnostic term you wanted to give it was almost interchangeable on the basis of these records. They were discouraged, fearful, worried young women who needed support and would express a variety of ideas in that context to win what they were looking for. That's the way to understand these people, in my opinion. And a thorough psychiatric examination and a thorough and adequate psychiatric plan was needed by them and was not received here anyway.